So let's categorize some clinical conditions of the hip so that you can streamline your subjective and your objective examination and be listening out for the profile of how you're going to decide which one of these is the most relevant diagnosis for your patient. So we have a bursitis and tendinopathy, osteoarthritis of the hip, a labral issue, we have fracture and bony concerns, and then we have a referral, and most likely from the lumbar spine. So in this category, we're looking at potentially glute med tendinopathy, trochanteric bursitis, hamstring tendinopathy, adductor tendinopathy. All of those fall under this category. And when we're looking at fracture, we're potentially looking at stress fractures, FAI, but also some adolescent pathologies that can be quite sinister that we should be concerned about, such as Perthes or slip capital epiphysis. So you can start to hear a bit of a pattern happening, is that potentially if you had a middle-aged woman present to the clinic complaining of, so middle-aged woman, the age category fits correctly, complaining of lateral hip pain. Once again, we might be in this category. She's tender on palpation of the bursa and around the glute med tendinopathy insertion, and your tests are positive for a glute med tendinopathy or a bursitis, then obviously this starts to become the clear winner, and you've mounted some really hard evidence and gathered all the clues to indicate that this is your most likely diagnosis. So that's how you need to start thinking and hearing those sound bites in your subjective, and then testing according to what you hear in the subjective to get to your diagnosis.